ನಾನು ಹೆಬ್ಬಾಳದಿಂದ ಬಂದಿದ್ದೇನೆ. ನನಗೆ ಈ ದಿನ ತನಕ ನನಗೇನು ತೊಂದರೆ ಇಲ್ಲ, ನಾನು ಚೆನ್ನಾಗಿದ್ದೇನೆ, ಊಟ ಎಲ್ಲ ನನಗೆ ಹಿಡಿತದೆ, ಮತ್ತೇನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಈ ದಿನ ತನಕ.
ನಿಮಗೆ ಹೇಗೆ ನೋಡ್ಕೊಂತಾರಮ್ಮ?
ಎಲ್ಲ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಳ್ತಾರೆ.
ನಿಮಗೇನ್ ಅನ್ಸುತ್ತೆ?
ಇಲ್ಲಿ ಚೆನ್ನಾಗಿದೆ ಅಂತ ಅನ್ನಿಸ್ತದೆ.
ಈ ವಾತಾವರಣ ಹೇಗೆ ಅನ್ಸುತ್ತೆ ನಿಮಗೆ?
ವಾತಾವರಣ ಚೆನ್ನಾಗಿದೆ, ವಾಕ್ಗೆ ಹೋಗ್ತೇನೆ, ಎಲ್ಲ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾರೆ, ವಾತಾವರಣ ನನಗೆ ಹಿಡಿತು.
ಟೈಮ್ ಸರಿಯಾಗಿ ನಿಮಗೆ ಕೇರ್ ಮಾಡ್ತಾರಾ?
ಹೌದು, ಊಟ ಮತ್ತೆ ಕಾಫಿ ಏನ್ ಬೇಕ ನಂಗೆ ಇದುವರೆಗೆ ಮನೆ ತರ ಆಗಿದೆ.
ಮನೆಗಿನ್ನ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಂತೀಯಾರ ಅಂತ ನಿಮ್ಮ ಒಂದು
ಭಾವನೆ.
ಖಂಡಿತ. ನಿಮ್ಮ ಹೆಸರಮ್ಮ?
ಲೀಲಾವತಿ.
ಎಲ್ಲಿಂದ? ಹೆಬ್ಬಾಳದಿಂದ ಬಂದಿದ್ದೀರಾ?
ಹೌದು.
Namaste. I am Dr. Subhashini, primarily a psychiatrist who is into dementia care. I am a consultant dementia care at Athulya Senior Care, Bangalore. So I am here to explain to you about what dementia is, what are the symptoms and how we can manage, and what we provide at Athulya. So dementia, it's a neurodegenerative disorder, which means the brain cells are getting atrophy, they're losing their function, and because of that, there are many cognitive difficulties in the client. They also have behavioral and psychological issues. So there are different types of dementia. Most common is Alzheimer's type of dementia, which affects the brain cells because of deposition of abnormal protein in the brain. And the second most common is the vascular dementia, which is because the blood supply to the brain is compromised, and that causes decline in the brain function. And there are other types of dementia which account for about 10% of the total number of dementia. So now we know what dementia is. So what will happen in dementia is, initially they'll start with having disturbances in their memory. So they'll start forgetting what they had for breakfast or what they had for lunch. They'll forget whether they had medications. They'll misplace things and they'll be searching for it more than usual. Usually we also search for things, but maybe probably twice in a month. But those who have this dementia, they will search for it every day, even several times in a day. So it will start like that and slowly it will worsen. So this memory is going to affect every part of their life, and it is going to affect their activities of daily living. By activities of daily living, what we mean is activities very simple as brushing, bathing, dressing, everything will be affected because of dementia. So initially the symptoms that we notice in them are memory loss, misplacing things, and slowly they'll have confusion with day and night, and slowly they'll become agitated and aggressive because they get confused, not knowing that where they are, what they are doing, who are the people around, and so forth. So they can present with agitation, aggression. They can also become sad, depressed, because they're not able to function as before. And mostly when the family members notice is when they have a behavioral problem, when they are very much irritated, when they are angry, or they hit people, or they are not able to do their everyday things. And in men, it is mainly noted when they are not able to go to the bank and fill up forms, withdraw money. So it can present like difficulty in finance handling as well. So when you suspect somebody who's having problems with memory, what we can do? So first we have to notice or observe what are the things that are different in them. So you observe them for their everyday activities, observe them for finance handling, observe them for their sleep, their food intake, how they're taking medications. If you feel it is affecting other parts of their life, that is, if the memory problem is affecting all this, we go to a doctor. What does a doctor do? Usually they'll take a detailed history, they'll find out what is causing the memory problem and what aspects of life it is affecting, and from there on they'll do assessments, they'll assess the memory function and other functions of the brain, and slowly they'll ask for scans, they'll ask for investigations to do to narrow down on what type of dementia it is, right? So after that they will be prescribed medications as well. So there are medications called cognitive enhancers which are going to help with the brain functioning, and it is also going to help reduce the behavioral problems. So why do you need a residential care? So for those, mostly these patients will rely on somebody to supervise them. So the caregiver becomes a must when they are going to progress in this illness. So when they are in the moderate to the severe stage, they would need some caregiver taking care of them for the daily activities, for eating. They might need help with them going out, social activities. They need help with their bathing. So it becomes an add-on burden for those taking care of them. So the family members, when they are working every day, all the members are working and the children are going to school and coming back, it becomes a added activity for them, and some might have to forgo their job to do this. So this that is why the dementia residential care has been started, where the family can get respite. So if we admit a client with dementia, so all of these factors, all of the domains will be taken care of. So what are the domains that we take care of? One is the cognition, the brain function, which is there are two forms where we manage the cognitive decline. One is, as I said earlier, cognitive enhancers through medications. There are other non-medication therapies as well, which one of it is cognitive stimulation therapy, where it is nothing but giving them a structured activity every day, which helps them to be cognitively active. It also helps them to be engaged throughout the day. So once they are not able to be themselves, they are not able to stimulate themselves, they might get agitated or aggressive. So the first domain is the cognition. The second domain is their everyday activities, as I said, bathing, brushing. So they will need care for all this. So in the residential care, we provide the care for the activities of daily living. The third domain is when these clients have behavioral and psychological symptoms. As I said earlier, they can be agitated, they can be aggressive, they can be sad, they can have there are a myriad of symptoms which can happen in dementia because of memory. So all these will be taken care, either pharmacologically or non-pharmacology, that is with medicines, and even other therapies are there for managing the behavioral and psychological symptoms. The next domain is about their physical health. So the clients with dementia won't be able to tell us, anybody for that matter, whether they have pain, they are thirsty, they have constipation, and they won't be able to tell us if there is anything disturbing them physically, right? If they are going to have, if their sugar levels are high up, they won't be able to tell they are feeling giddy. So all these have to be observed, and all the physical symptoms will be managed by our caretakers as well as through our instructions. So these are the domains where they will be taken care of, and add on the environment in which they are is made dementia friendly. So the clients with dementia can have confusion where is the toilet or where the dining hall is. So we have certain environmental modifications for that. So simple as having a different color for the toilet door, or having a signage on the door, and we have handrails everywhere, so that when they become unstable, they're not able to walk and walk properly because their brain is getting degenerated. So to help them walk, so we have handrails fitted everywhere, and especially in the toilet, there it is also made dementia friendly. The simple as the buckets and the mugs that they use, they are of different colors, so they can differentiate between the toilet commode and the bucket. So all these are thought of, and they are made dementia friendly to make our dementia residential care good. So that brings us to the question how we can prevent dementia. So there are certain things that we can do to prevent dementia as a general public. So it is similar to all the other diseases, lifestyle modification. So you have to have a healthy diet, do not eat junk food too much, obviously, and be physically active. At least 30 to 40 minutes of physical activity thrice in a week is compulsory, even for those without dementia. After you if you are loved ones or you have been diagnosed with dementia, you should be physically active even then, which helps them to stimulate the brain as well. The third thing, if you are diabetic, if you are hypertensive, everything has to be under control. So you have to go to your doctor regularly, get a review, get your medications changed, and maintain your blood sugar levels, maintain your blood pressure levels, maintain your cholesterol levels. And the next thing that I want to highlight on is about your hearing, your vision. Everything has to be pakka. So if you have problems with your hearing, corrected, wear a hearing aid. If your vision is poor, corrected, wear a specs. So all these put together will help at least to postpone the dementia. If there's a history of dementia in the family, you can postpone it, right? I have seen clients. There was this one family where all of the sisters and brothers had dementia. The last one, when I saw him, he was 80 years, but he was the last of all the siblings, and he got dementia only when he was 82. All his brothers and sisters had dementia when they were in 60s. The only difference that it made was his physical activity. He was practicing yoga even at 82, and his diet was so strict that he'll have only nutritious diet. He won't have junk, right? And another thing I would like to highlight on is you have to cut down on your smoking, cut down on your alcohol as well. So all these put together, mainly lifestyle modifications, is the one which is going to help you from getting dementia earlier.